Hope Channel, changing lives.
Hi, good evening once again. Welcome to Wounds of the Heart Season 2, and it's going to be a wonderful season ever. And trust me, this time around we're not going to sit in studio because you can see I'm not in studio. We're going to go to offices, open places, just to bring the conversation right to your doorsteps. You know, Wounds of the Heart, as we usually do and we always do. We bring professionals for them to tell us the reasons why people do certain things and how best they are going to be helped. Today, I'm privileged to come with you with a gentleman. Very soon he will introduce himself, and he is going to commence this season 2, and it's beautiful. I wouldn't talk much about it, but when the time comes, he will introduce himself. But you know, we are live on Hope TV GH, both Facebook and YouTube. So once again, I click on your indulgence to click on the notification button on Facebook or YouTube and share the links to people for them also to be to watch for this program, because it's very educative. You know it already. And in case you want to send your comment via our WhatsApp platform, is 0559 680066 0559 680066, and if you have any question you want to ask pertaining this program, you can send your questions there. And also 0208 491919 0208 491919. This number is for sponsorship. This number is for aftermath questions. This number is for aftermath care that you may need for your child or for your family member who is going through any form of addiction, so that I can connect them to people that come on my set, because together we want to help people who are in those aspects. And as I said, Fabric by Slick Afrique, we have started again, and we know Slick Afrique has been so much supportive since we started this program, and Slick Afrique is still there. Slick Afrique has added something called casual wear by Slick Afrique. It's already sewn material, purely African print that you can. So if in case you need some for your programs, the number is 0557 355 852 0557 355 852. And you know, this young man called Alpha Art, you know, he has been the one putting the flyer on putting our pictures on flyer, and he has been good since day one. Alpha Art covers a lot of events, so if you need Alpha Art, please, you can call on him on 0551 404 387 0551 404 387, and Alpha Art would do beautiful work for you. And as I said, if you want to call Aftermath for any question and anything about the program and sponsorship package for the program, you can do so by calling 0208 491 919 0208 491 and it will be going through on your screen, so you can pick it and call. We want to come to your offices, we want to come to your schools, we want to come to your church. Invite us and we will be right there. And the program is Wounds of the Heart, and we are back on your screen. Today we're going to discuss an issue that a lot of people are baffling with. But today I have someone here who is going to talk to us and educate us about the topic you saw on the flyer. And today we are discussing what we call honor. And I have with me a gentleman whom I'm going to allow him to introduce himself. Good evening.
Good evening, sir.
And please, welcome to Wounds of the Heart.
Thank you for giving me this opportunity.
All right, so
grateful.
I thank you so much. I don't want you to, but you know, since it's the first time on my program, I want you to look into your camera and tell my people who you are.
Well, my name is Charles Osei, and I'm a certified addiction professional and counselor. I'm the head of addictive disease unit, Korle Bu Teaching Hospital, and I'm also a mental health practitioner. So I'm very grateful for you to have me here.
All right. So before we enter into the topic, do you do private counseling when it comes to addiction?
Yes, I do private counseling as well.
All right. So viewers, before we will be done, I will let him put his contact through so that at least if in case you need him, you can call his line, or you can call my line as well, and I can also direct you to him. He does family counseling also, especially with addicts, and because he said he's a certified. But the topic.
Parisian by now. I mean, I learned, but the point is he's not a creationist who I learned long ago.
Flowers and a bat are what we refer to as marijuana, and people smoke it. And this one, because it's a psychoactive substance, because it affects your mood and your mind. It affects the way you talk, the way you perceive things. And what happens is that it contains a substance called the THC, and that is what gives what we call the high, or the euphoria, or the happiness when people smoke and they say that I am high.
All right.
So basically, that's marijuana.
So marijuana is a plant.
It's a plant.
So whether dry or it's still greeny or whatever, the plant is called marijuana.
That is it. That's a marijuana plant.
Okay. So, and you said there's something THC in it that makes that cause. We'll come there. We'll come to that aspect
content.
Because I want my viewers to know what marijuana is. We know. Is it the same as we?
Yes. That's the other names. We have some local names that people give it names those times because they just want to, because of it's illegal, and they want to hide the real name. So they decide to give it certain names at the ghetto so that people may not know when they talk about it. So we have weed. Like you said, we have cannabis.
Cannabis.
Now I recently heard one called Buga.
Buga is a dance.
Now it's called weed is called Buga in some of the ghettos.
Okay.
Now we have one we call like we said marijuana. Then we have dope.
Dope. Okay.
We have dope. Some people also call it Abonsam Tawa.
Abonsam Tawa. Okay.
So they are, as for the names, a lot. When you travel outside Ghana, different.
Okay.
Some people call it Kush. And all those funny names.
Is it because people doesn't want to know that this is what I'm going to do? So around us, those who smoke weed or marijuana, let us give it a name so that at least it will come. Okay. Okay.
Like you said, there was this funny thing I was watching. Somebody just went to a ghetto and said, I'm buying weed, and they were like, wow, who asked you to come and buy weed? Next time when you come, call it this name. Don't call it weed.
Okay.
Okay.
So
these are some of the ways that.
All right. I want to ask this question since you are an expert about addiction expert. Please, is marijuana useful? Is it helpful to the society? Marijuana, not in marijuana, the plant itself.
Okay. Like I told you, marijuana is a plant, not the plant itself. Okay. So the weed, the people, the ones that they smoke, what you see, what happens is that they are saying that in order to, you see, there's an example I'll give you. There's a place where they sell monkey meat.
Monkey meat.
Monkey meat. You see, and it's around where I stay in my hometown. And when you go there, people know monkey. So when you go there, they say meto asroba, so that the people from other places will not know that is a monkey that you are buying. I get to the point. So that is the weed. People say it's for recreational purposes. Like that's what they say. You see, but my problem is that there is something inside the weed that is addictive. I get to the point. And before you get to the level of addiction, you travel. So if you tell me that you are doing recreational smoking, definitely you will get to a point where you will be addicted. So for me, that's what I see. It's for recreational purposes. Some people also use it. When you go to this spirit world, there are some people who use it and enter into trance.
Okay.
Like yoga, there are some other that use them. That's some of the use that for now I can tell you.
But they are products that you could see African herbs.
They are products African herbs. But that percentage of marijuana is negligible. I get to the point. It's not the one that you use and get high. I get to the point. It's just a little that they add. So these topical ones that they use, and but this one we are talking about is the one they smoke it.
All right.
Raw.
I you see, people have that perception or that notion about weed, but the amount that it's in
is not something that will affect anybody. Because if you talk about that one, there are some other medications for epilepsy, for depression and all those
that
things. Has a weed content. That has that kind of cannabis. So that one is just for medical purpose, medicinal purpose, and it's not one that you can. We call it, what you are saying is rationalization. I want to use it, so let me just say something to support my. It doesn't make any sense.
All right. So viewers, we are talking about marijuana. You see, in case you just joined in, we are discussing what marijuana is, and and why it has a lot of names, because sometimes it depends on the ghetto in which the people want to call it a name that will confuse we the laymen, those of us who don't know what it is. And also we just said that yes, people use that product for health issues, but then not necessarily the amount or the quantum that is being smoked into the system, or the THC in what we smoke that is applied into the body cream and hair pomade. It is different from what we see on those labels. So let us be mindful, or we shouldn't rationalize things or have perception about the fact that is it. So if it can be used for hair pomade, then we can smoke it. It is normal. I want to get back to him. Currently, marijuana has been something normal. From your perspective, how do you see it being normal, especially with the young people, and why?
Okay, so like I told you, I work at a unit where we do counseling for people with substance use, and I will tell you that, initially it was nicotine, cigarettes that this young boy starts with. But I can tell you the fact that now the young boy starts with weed. Are you getting it? But they start with weed, and there is a study by the, I think, consultative something of Ghana recently about this GHS-SS, and you came out to say that about 50% of people in GHS have smoked weed before. Are you getting it?
50%?
About 50%, I think 49 to 50%.
Okay.
Not very sure, but and you look at the other side, there's one they call shisha. That's
Shisha, okay.
That's
shisha,
the study brought
yeah.
out that there's a number of female who also do that. Are you getting the point? So, for me to tell you this one is that, I was telling you earlier on that even in Ghana, when you look at the amount of weed used in countries, Ghana was ranked as one some time ago.
Ghana was the
first in Africa and about third in the world. You see, but currently I saw that Nigeria and some other countries are climbing up.
Okay.
So it fluctuates. Okay. Get to the point. So it's something that is alarming and it's serious because the guys who come to many of them is cannabis and something.
Okay.
They don't come with cigarettes and some other drugs. Now come with, I told they start with cannabis. Cigarette is something they just put it down.
Oh, it's normal. It's now.
So
okay.
The cannabis.
I know you're doing.
So they are cannabis now they come with, and most of them come. They have psychosis. They come. They are misbehaving. They are hallucinating, seeing things that you are not seeing, and you need to stabilize them at the psychiatric hospital before you bring them in. So it's something that is becoming a serious problem in our country here.
If you have if you have a sibling, if you have a nephew and niece who is into weed smoking, he wouldn't tell you, but what we are going to enter is what will let people know, get the signs and symptoms of whoever is smoking for us as parents, guardians, or whoever we are to those people, to be able to know that indeed these people are smoking. And what are the symptoms of someone who takes weed, who takes marijuana?
Okay, so the symptoms of someone who takes marijuana, normally their eyes are red. Like you see something like a bloodshot eye. The eyes are always red. Then what will let you know that it is weed is that the lids are swollen, like somebody who just woke up from bed. The eyelids are swollen, like somebody who just, because there's some people whose eyes are red.
Oh, wait,
so
please, I want you to take these things carefully for me, please, so that at least you can identify and we'll help out. You can call the number and we'll help out. So please, I want you to do that. In case you haven't shared the link, please do so. Send it to young people's platform, church platform, any group platform, so that at least together we learn. Because it's going to help somebody in your group or a parent. Anybody, please. So let's do it. So yes,
like I was saying, the eyes are always red, but to differentiate it between somebody who has a different problem and eye problem is that the lids are always swollen. Okay, like somebody who just woke up from bed. And what happens is that the youth that enter into, you realize that initially academically they were good. It's possible it could be another problem, but most of them academically they are good, but as they start using, now they start failing, and you see that they are not doing well in school. Then they have this talkativeness, getting into arguments, I get to the point, and they become living secret life. You realize that they start changing friends. You realize today is a friend, they change a friend. They bring different people to the house. And what happens is that they also put on bangles. You see these young boys, they put on a lot of bangles. And there's some crosses.
Is it not life? Is it not
differentiated from life? This one becomes too bad. You realize that they are putting a lot of, these bangles, like, first they were not like that. You realize that they are putting on bangles, and you go to their rooms, they put some Rastafarian, you know, excuse me to say, they put some pictures of somebody smoking weed and all those things. Then they have paranoia. When I say paranoia, now they feel, they have this feeling that people don't like them. People are looking at them, you know, people are talking about them. They have this kind of feeling. Now, they hate, what they hate is eye contact. You know, because of the red eye. So they normally hate eye contact. They don't want you to look. So you realize that when you look at their face, I say, why are you looking at my face? Are you getting the point? They always putting their head down, not to look at people, you know. So these are some of the visible ones that you can see. Now, the long term, you realize that some of them, the color change. You see somebody who is fair but becomes dark, like me, with time. You realize that, you know, you see the signs and you realize that, no, they are not like they used to be. You see, then you realize that the mouth, like I'm saying, you say that the mouth becomes very dark. Now everybody knows you watch the mouth very well, you realize that the mouth changing is very dark. The lips have become very dark after a long time of use.
So for instance, if my ward is a student, how do I know, a brilliant student, how do I know that?
That's what I was telling, that is some of what happens with time. But you need to, what you have to do is to also, if you have children, you need something about weed. If you have children, you need to investigate them seriously. That's how you start. You need to learn about your children. You need to go to their schools and ask about how they are doing. You know, sometimes you have to take 1 or 2 ways and set their bags when they are not there. Because that's how it starts. You know, some of them you can even hear the smell if you know the smell of weed. You know, now, like I was telling you, now there are different types of weed. Now the smell is not there. Some of them are changing. You know, we have amnesia and all those things. We'll talk about that one later. You don't have any smell. You see, like before. So now they smoke and you don't have the smell.
No, that one might be expensive because
there are some expensive marijuana. You know, they have even synthetic marijuana. I think we'll get there.
Yeah, we'll get there. We'll get there.
You don't hear it. You see, there's an advancement, so you don't hear it. So what you do, have to search and get it. If you set their bags, normally they will hide it in their bags. So you need to look inside their bags and you need to talk. The education is very good. As a parent, you need to educate your children that this is what is not good, this is what is good, this is what, if you do, what will happen. That is what is even very important for you to tell them, educate them, let them know. When they ask you questions, answer them. Don't tell them that, oh, don't worry, when you go, you know it. They want to experiment it. You are getting the point. So we have to educate them, let them know what is supposed to be known.
Well, you've made mention of behavioral symptoms. How do we know of, in case if there's any psychological and emotional, how do we, a lay person, you may look at somebody, even the way he speaks or he talks may let you know that, okay, this person is an addict to probably marijuana, because psychologically there might be fear, there might be panic, there might be all those things. Aside these things, how, without physical appearance, without seeing that short red eye, blah blah, what again psychologically can we say that, oh, this person is sick of he's an addicted, or he's an addict, or she's an addicted to a certain drug called marijuana or something? Is there any psychological symptoms that it can also let us, some of us, know?
Okay, so what happens is that if the person is addicted to the drug, definitely we have something that we call withdrawals. Okay. You see, they will start, depending on the type of drug. If it's marijuana, if they become restless, they become irritable. That is when they don't get the drug. You see, they become irritable. Some of them, they sweat. Even when the weather is hot, weather is cold, you see that they are sweating. You see, then the weather is even hot and they are also cold. You see, they have those kind of weird behavior, and they will seriously be aggressive. You see, so some of them, you get a drug for them and
they are fine.
You see, so that is what will make you realize that your world, there's something happening too. And when they do that, if you leave them, they can cause trouble. You see, so the people who are lay people will just look for some and give it to them. Okay. So that's how.
So we need not to give it to them.
You need not to. They just need a medical treatment. You just have to send them. That's why we have an addiction clinic.
Okay.
Just send them to any addiction clinic.
Okay, we'll come when we talk about the health. But I learned that those who also smoke eat a lot. I don't know.
Yes, for marijuana. Yeah, marijuana. Right. That's one of the things I even forgot to tell you. You know, marijuana is an appetite stimulant. You get me? So people take it initially and they eat well. You get me? They eat well. But what happens is that with long-term use, you realize that the person will be eating well, but he will not get any flesh. Are you getting the point? They will not get any flesh. They will eat a lot and they will not get any flesh. But initially when they start, some people will tell you that because they want to eat. You know, when they start, they said when they take it, they eat. Are you getting the point? I'm telling you that drug is something that initially will boost you up, but at the end will destroy you. We have something we say, drugs takes you higher and brings you low, and get to your lowest point. and you regret you ever started it.
Never started
You see,
it.
so those things are just something that
So you need not to start at all.
you need not to start. For me
start.
as a therapist, I'll tell you that don't even start it because of the addictive nature of the substance.
Friends, we are discussing marijuana effect on people, the psychological effect of marijuana, its effect as to how best it's going to kill somebody, as to how best it's going to affect someone's life forever. And in case you just join in, we are deliberating on that issue, and he has said more about the signs and the symptoms that we'll see. Having possession drugs, people, their eyes become red and they have black shots in the eyes. Their legs swell like that of those who are just woke up from bed. The fatigue sets in, they eat a lot because it's appetizer. A lot of things happen. They withdraw, and should they don't get some to smoke, they withdraw. But at the end of the day, these are things we are doing just to make sure that our families are safe, our friends are okay. Those who have started something will stop because it's not going to take them anywhere. People will say that marijuana causes people to learn.
That's a lie. That's a lie because, you know, one of the symptoms of marijuana use leads to low concentration.
Low concentration.
Yeah,
so those on stage, the artists, those who want to smoke to be high, because from here we are entering into the courses. Those who want to smoke to be high on stages. I read an article and it said that smoking makes the writer write well with all creativity that they deserve. How you guys how true is this thing?
You see, what happens is that, like I was telling you, drugs that are addictive have an initial booster. I get to the point. So it is your mindset.
Okay.
Imagine that you want to take something and do well. That is your mindset.
It's mindset.
So immediately you follow up with the thing. It is human. That's what you have decided. So initially it will boost you up. But ask those people who said they use it for learning. Ask them that when they get to their qualification, after you have gotten your A's, are they able to work? The time that you are supposed to work, now where is your strength? Everything is gone. You have wasted. You know, let me tell you something about marijuana. You see, marijuana, when you take marijuana for a long time, what marijuana does is that it makes you work harder sometimes.
Yeah.
And what happens is that it takes a lot of your energy.
Okay, at a go.
So imagine that you have to take like 2 minutes, let's say 30 minutes to do something. Marijuana will let you take like 10 minutes.
Okay.
And when you do that, naturally your body will not get that energy back.
Exactly, okay.
So
okay.
you get to a point that you have exhausted all the energy system in your body. That's how come you see that they are not going fat again. Now you become so lean and you cannot do everything you do will not bring you back to your normal because you have wasted the energy center or the energy source that you need as a person. You see, so it will give you this thing now and you'll be overusing what you are supposed to do. And by the time you get to a point where you are supposed to relax and enjoy life now, where is your energy?
Okay.
Are you getting the point? So that is what you have to look at.
Okay.
Are you getting the point? Nobody deceive you that marijuana can make you steady. Ask them what they gain after they have gotten their degrees.
All right. So let me pass on this one. My morale people, you see, you can be normal to give the morale. Don't allow marijuana to boost that strength in you.
Exactly.
That you can stay all night doing morale. Because when you're done, you can't recoup that morale back. You can't. The strength that's where you can't bring it back.
That is it.
You can't bring it back. We're going to the courses right after this break, and the program is Wounds of the Heart. We are back with a different season. This time around, we are going to offices, we are going to homes, we are going to their comfort zones to bring this interview right to your doorsteps. Please, in case you have never shared this link, I want you to share it to people who also would have interest in learning and also helping other people who are addicted to whatever we discuss right here on this program. Please don't go anywhere. I'll be right back.
Hope Channel Ghana present All Night Service on Saturday, 8th of October 2022 at 9 p.m. at the Asamankesi Central Adventist Church, live on Hope Channel Ghana.
The Seventh-day Adventist Church Ghana presents The Coming King, A 10-day Bible lecture series from the 12th to 22nd of October 2022, 6:30 p.m. each night.
There is a coming King who has answers to all our challenges and cares in this life. You may have your doubts, but that is why I'm inviting you to join us in the Bible lecture series, where we believe to find answers to our challenges, and your life will not be the same. God bless you.
The Coming King, a 10-day Bible lecture series, live from 12th to 22nd of October 2022, 6:30 p.m. each night.
Only on Hope Channel Ghana and all Seventh-day Adventist churches in Ghana.
All right, welcome back from the break. It's Wounds of the Heart. It's an awesome Wednesday. Today is 5th October 2022, where we have begun the new season of Wounds of the Heart. Today I have with me Charles, who from ADU. He made mention of himself. If you want to know him, start play from the top, and you're gonna see who he is. And right when we are closing, he's gonna give his digit also, at least to help people who are into this. We left off when we are about discussing the causes. Charles, what are some of the reasons why a young boy of 12 years old, 14 years old, a teenager, will enter into marijuana smoking?
Okay, so we call them the risk factors.
Okay.
Right? So, risk factors are factors that it may or may not. When we say risk factors, it may or may not. It's possible somebody may go through some kind of situation, but it's possible he will not get into marijuana. So we have something we call incest. There are some people that probably when they were growing up, that's a psychological problem. They were maybe manhandled by a family member. Incest, that somebody having sex with a relative. And sometimes when they grow up, this feeling of hurt may lead them into drugs, and they can start using marijuana. Now we have introverts. People who keep their problems. You see, we always advise people to talk about your problems. If you are an extrovert, you are good to go, because you are somebody that talks about your problem and you may need help. We are saying that a problem shared is half solved. Me, I always say that if you have a problem, you share with 5 people, you are divided into 5. You are taking 1, 4, let them take it. So we have to learn to be talking about problems. And people like that always, they are secretive. Later realize that they are using without just to help themselves out of their problems. Now, we have bad parenting. Some parents who want their children, pamper them, will not talk about them. We have this broken down homes and all those things. The father is not there, the mother is not there, the children are just there, and they are doing whatever they want. We have victims of treatment. There are some people that, in the olden days, or not, even our now new world, they want to say that there's some disease that they want to help you with marijuana. They say that when somebody smoke or somebody took some of the marijuana, marijuana, we eat them in food. They are the dried ones. I should have that. Some are in food, some are in cake now. People use it for cake. And people in toffees. I don't know whether I know that.
No, I know. Yeah. But it's sold secretly, and
yeah. So it's the same marijuana, the dried. That they use it to cook and eat and all those things. So it's like I was talking about. Like giving it as a victim of treatment, So they want to give you, say, oh, somebody had this problem and they gave it, So they were young. That's victim of treatment, and they gave. So maybe they gave, and the person was also enjoyed it and decided to use it. Now we have something called heredity. Boss, as we are sitting down here, there are some people that are unfortunate. Are you getting the point? They were born into a family where, excuse me to say, there were addicts in the family. You get me? So that one, you can't blame the person. You were born into a family where you have a genetic predisposition to addiction. Imagine your family, your dad died of alcoholism, your uncle died of weed smoking, you get me? So if you're a child in that family, what you have to be taught is that you don't have to start using. That is why I support don't start it. Don't start it. Because there are some people who start today and will become addicted in a few days because of their predisposition, their genetic predisposition. It's not your fault. The family is a family where there's a problem of weed, alcohol, everything. So immediately you start, it will not take long, and you cannot do anything about it unless you work on yourself. Are you getting the point? So that is some of the things that we look at. You know, these are risk factors. It's possible somebody can find himself even in the center of the weed house, but will not.
So we shouldn't compare ourselves to say that somebody had smoked for weed for 10 years, 20, nothing has happened.
Because you don't know some people even don't know their family history. Okay. It's possible there were some of your grandfathers who died before you came, and they were alcoholics. She gets me. So it's in the blood. So when you start it, the possibility that you become an addict is high than somebody who doesn't have that predisposition in the family. Are you getting the point? There are some other people who also smoke and use drugs when they were pregnant. So that the child that is even in the abdomen is suffering. You need to give birth to some children who withdraw because the mother have drunk alcohol on them and they start misbehaving as if it's an alcoholic who is in withdrawal. Can you imagine? You see, so these are some things that when you do, you even make the child, you put the child's life at risk. Either you become a stillborn, probably you don't even, you have some brain problems when you give birth to them. When they are lucky and they survive, they also become alcoholics in future. Are you getting the point? So these are risk factors, a lot of them. So, and you mentioned when we're talking about the signs, symptoms about they changing friends here and there. Yes.
The number of the caliber of friends that somebody as a student, because I don't see the reason why somebody who is 12 years old will start smoking weed because probably he has never seen the father smoking or the mother smoking, or he's not coming from a home that smokes. So how would he?
So that's peer pressure and curiosity. That's peer pressure because when I was in secondary school, I remember there was this place that you go. Sorry to say, we call the White House. When you want to go and eat yourself, you go there and you may see a senior who is smoking, and because they know you have seen them, they want to
put it on.
Sometimes force you to also smoke. Are you getting the point? Or probably you meet a colleague who also smoked for the first time, you see. And that's why I'm saying that the education should be there. Before you send your children to secondary school, tell them about drugs. That this school that you are going, you definitely meet somebody who smoke or drink. When you meet him, do this, do that, do that. If you don't tell them anything, when they meet, curiosity will let them see what is inside the cat. Are you getting the point? So education for me is a key. The key. Don't tell yourself that you are too young for that. They know everything. When a child asks you a question, he has an answer. So tell him the right answer so that he doesn't use his answer.
Tell him the answer so that he doesn't
use his own perceived answer that he has. Because you always have answers before they come to you. You want to see whether the answers are correct.
So if it's wrong, you, the father or the mother or the elderly brother, can diffuse that and he'll go and say, my brother said it's not right. So he'll go. But if they come and we say, oh, when you grow, you understand, then he's going to go with
their colleagues are saying. You always say what their colleagues are saying. It is maybe wrong.
What of the area that one comes from?
Yes, like you say, you see, there's something about environmental. You see, when you go to some communities, everybody is drinking, everybody is smoking. You see, so if you are in that community, how will you save yourself? And probably when you even go to the house where they are coming from, the dad is doing it, the mom is doing it, I get it, but the area is doing it. So it's environmental. You see, but like I was telling you, there are some people they come for that environment, depending on how they were brought up and the things that they have gone through. They may decide not to. There are some people, but it will be a few people. You see, as you are growing up, adolescents, you are learning a lot of things. And there are certain things, without much care, you will do it. Because you are growing up, you need to investigate things and enjoy things. You see, so it's also a challenge. It's a big challenge.
This is where I want us to take our time to talk about it. Because this is the apex of our program. How destructive or how whatever we discuss here may destroy one's life. What are the effects if it can be divided into psychological, physical, emotional, however effect it is, or if you can go through it.
So let's start from, like you said, social.
Social.
You see, so social effect. You know that definitely when you smoke, there will be no respect. Nobody will respect you. You get me? They will not show respect to you. That socially, you get me? And you cannot. Employment. If you are in employment, people will not want to employ people who are having problems with drugs. You get me? And you know that there's kind of this armed robbery, stealing, and all those social vices because the person needs. Although, like I'm telling you now, weed. People used to say weed is one cedi. Now weed is expensive. Weed that expensive. You see, and I was telling you that people don't want people to hear the scent and all those. There's a raw one where you hear the scent and it's like now they buy. You get me? And now for me to tell, there's something we call synthetic marijuana now. It is made in the lab.
Okay.
That's the medical.
And it's
made
so
in the lab.
The THC is composed in lab.
And like I'm telling you now, as I'm sitting down here, if you ask me, I cannot tell you the composition of that thing because they are using a lot of things And you don't know, you get me? And people take it and they are hallucinating, and that's why I'm saying that the most of the psychotic ones that we are having, probably they also went to use that one because they think it's weed. But this one is made from the lab, and it's in Ghana here now, and people are using it. Are you getting the point? So it's a lot, and I'm saying that for the social problem, you know, it affects the family as well.
Exactly.
And everybody become confused in the family. You get me? So the person that comes from that family and the family itself are not okay until the guy goes to treatment and finds it well. Now let's go to medical. You know, the medical one, there's something that is coming out. There's a study now that is showing that people who use weed for a very long time have something called testicular cancer. There's a cancer of the testicles.
Okay.
And it's becoming something about people who smoke weed. There's a new study. And you know that when you smoke, definitely, Master, you're here.
The cancers
From the mouth going down, combined with cigarette, you know, that's their problem. The lungs, everywhere. You see, and now the kidney, definitely, and your liver is also will have problems. Are you getting? So, it is something that you shouldn't use and be happy about. You know, this, like I was telling you, now we have psychosis a lot from weed. Somebody was saying that if you want to get this, you know, like I was telling you, our own man, Akwesi always tells us, always tells us that majority of the people who have psychiatric problems, some of them have a history of marijuana use. Our own Akwesi.
Okay.
You see, so where do we want? What do we want again? What information do we want again? Are you getting the point? Because it's a psychoactive substance. It affects you. You know, and it gets deep. So that's some of the things that you can have.
So then let me ask this. I don't know whether how does it affect the brain? How does marijuana smoking how is it composed in the brain? I don't know. I don't know how to put it, but
so let's make it simple.
Okay.
You see, there is something that we call dopamine. You see, and that one is what actually, when you smoke or you take drugs, you know, it gives you some boost. You see, there's something about the brain. The brain always wants an easy way out. So as a human being, whatever you do will activate your brain to work on. So imagine that you always smoke, drink. That's how you have trained the brain. You see, when you eat, the brain gives us a reward. But the reward that the brain gives us, no, is not equal to drugs. Whenever you smoke, you know, drugs, it gives you more reward. So you want to smoke more than what? Eat, or even have sex. That's how the brain is. The brain rewards. It's a reward system. And that's a dopamine. That's what does that. It's a reward. It gives you the reward and you are happy. So the euphoria and the joy that you get when you smoke, that's what the person wants. That's why he's smoking. And the brain will reward you for that. So there's a percentage that it gives you. The joy that you have is better than eating. That's why people will smoke and will not eat, or will drink alcohol and will not eat, because that's how it is. So it will always want you to do it. And when it gets to the addictive stage, it becomes worse, and it becomes a daily routine, and something you cannot do. That's why when you stop, you have withdrawals. So that's making it simple for you to understand.
Okay.
You see, so it goes that high, and when you know that anytime the brain gets, you know, when you have an MRI of the brain, we take a picture of the brain, you realize that an addicted brain has a lot of distortions. There are a lot of problems there. It's not like the normal one. If you have a normal brain, you have the addicted brain. If you take an MRI, you take a picture of it and put it down, you realize that. So addiction is actually a brain disease. It destroys, you know, the things that you find in the brain for a very long time. That's how come when somebody is using drugs, they will say that, well, badam. The lay people will say that, hey, well, badam for, because he smokes weed or he takes cocaine. Because they know that the way you are behaving now, you see, the addiction is actually a disease, but the disease comes up with behaviors. You see, so when you smoke for a long time, you drink for a long time, you start behaving as if, so you have alcoholic psychosis, you have all those things because you have smoked, you have drunk, and you are having problems in your brain. You see, it's not that there's some kind of psychosis that just came. It's as a result of the weed use, as a result of the alcohol use. That's how come you are having this problem. So we have something we say, you go to the hospital, you say alcohol-induced psychosis. You know, marijuana-induced psychosis, cocaine, you see. So it resulted as a result of the long-time use of this thing. Are you getting the point? That's how come that when they come, some of them, they have used and got into the brain to the extent that they are having psychosis, they are hallucinating, they are shouting, they are seeing things we cannot see. Are you getting the point? They are having paranoia, they think people are following them with knife and they come to kill them. So you have to tie them do something for them to stabilize them. Now they come back and they are normal before you can just sit them down and counsel them and say that, Master, this thing that you use is the problem that brought you here. So don't go back and use it again. Are you getting the point?
Why would people get mad when they take one smoke of weed in a pub? Then it's,
you see, it happens,
what happens that
you see that the thing is that weed itself, marijuana itself, is a psychedelic. As I'm sitting down here now, marijuana doesn't have a class. When we talk about the classes of drugs, we have opioids, we have opioids, we have stimulants, we have depressants, we have hallucinogens. Boss, do you know that marijuana can fit in all of the classes? Because somebody who smoke marijuana today and will be calm, that's a depressant.
Depressant, yeah, exactly.
Somebody who smoke marijuana and they will sit down and it's like they want to relax, that's an opioid. Somebody who smoke marijuana and start seeing things and shouting, and that's a hallucinogen.
Exactly.
Somebody who smoke marijuana and the other one, I think I left one out, you see, and you may behave like that. So
don't smoke marijuana. Don't smoke it.
That's how come somebody smoke and he just went off, because there are some people that is not even good for them. Are you getting the point? And we are saying that there are some mental conditions that are hidden in individuals. That is schizophrenia. So when they start smoking, now
it brings it back.
So you don't have the right to smoke. I'm telling you, you don't have the right to smoke. Don't tell me that you are smoking too. What if you have a genetic predisposition?
Okay. It's another point.
Let them use it for medicinal purpose. Let them use it for, it's used for, when you go to the industry, the fiber of the plant is used for textiles. So let them use it for them.
So that we can get more
dress to wear and stop smoking them and going off. It will not help you. Are you getting the point? Let's look at it that don't use it. Don't go and smoke it.
Weed and sex.
You want to see what happens is that a lot of the young guys, the secret is that most of the young guys who smoke weed probably also use it for, like I was telling you, we have cannabis sativa, and there's another one called cannabis luteca. Then I think there's rudeless. You see, that's the combination. When you go to where weed is planted, they know the difference. The sativa gives
that a female weed.
The sativa gives that euphoria.
Okay.
You see, that relaxing this thing. Then I think the other one gives the energy. You see, then the rudeless has has this one and that one. So there are some people who come from where they grow it, they mix the three of them, and they have that energy, they have the relaxing, they have everything. You see, that's going deep into the smoking. So this one you are talking about, some people have the mindset that tramadol and some other substances give you long journey when you sleep with a lady. And you know that there's some funny thing that we say that you realize that these people who smoke weed have the beautiful ladies.
Yes, because they can
go longer. But boss, the truth is that I was telling you that drugs will give you that idea, but you lose it. Most of those people become impotent in future. You see, most of them because you have exhausted.
Because
see, how can you do something for 2 hours when it's supposed to be done in like 5 minutes? People even do it in 2 seconds. Are you getting the point?
Please, pardon us.
So that is it. There is no truth in that. It will help you initially, but in the long run, you have to suffer for it, and you will not like the pain.
Viewers, we're still in marijuana usage. We've spoken about the effect and why we shouldn't even venture into smoking weed, buga,
Abonsam
Tower. It has a lot of names depending on the ghetto, the area in which you guys, the person, it's being generated from. Does it have a co-occurrent disorders?
Okay. So like you are saying, co-occurring is something that occurs alongside the use. When we hear co-occurring, something that occurs alongside the use of the thing. So like we were saying, somebody can use marijuana and like be psychotic. That is a co-occurring. Somebody can use marijuana and also have, become a patient of maybe a lung problem, a chronic lung problem. you can have a cancer.
Okay.
You see, they are all chronic
Okay.
conditions. So
Okay.
you see that you are using them and other getting other conditions as well. You know, somebody can become a social vice. You can even become a social assault, an armed robber.
Okay.
You see, or a thief.
Okay.
Because you may need it. And I'm saying that when you start using marijuana is a stepping stone.
Okay.
It will take you to use heroin and cocaine.
And other aspects. Okay.
Because that's just a stepping stone. When you start using it, to come to a time it will not satisfy you.
So
you
you
need
need
to
to
jump
add
to the other hard drugs. So it's the beginning for the most of the hard drugs for people.
So-
Anybody who smokes hard drugs will tell you that I started with marijuana.
So can we say emphatically that those who have smoked marijuana for a longer period of time had never smoked it alone, but then had added, may have added those things, hard drug like cocaine a bit or whatever. Is it possible?
So what you have to focus on now is that most of the people who use hard drugs started with. You see, but there's a possibility that there's someone who has been using weed for a very long time
but
and
has
not
never crossed that
But
line.
the thing is that when you start using them, it will get to a time that, I mean, there's something called tolerance.
Yeah,
you may
definitely.
cross tolerance and you want to cross to other drugs to make you a little bit stronger when you use them. Because the euphoria will not be coming again like you want to.
Now, we want to see how best our friends, our nieces, our nephews, our church members, our students, our colleagues who had fallen victim to marijuana addiction or smoking of weed, how best can we help them, aside what he's going to say practically, how best can we help them to overcome such a dilemma? Because it's something that we can't sit here and say that it's normal. They should continue. Per what we have discussed so far, Senior Charles, how then do we help people, aside whatever you're going to tell us practically? How best do we help people who are currently addicted to marijuana? Or yes, let's.
Okay, so
focus on
what
that.
happens is that, you know, when it comes to treatment, you know that I was saying that marijuana addiction is actually a chronic condition. When anybody who gets to marijuana addiction, it's a way that the person has to learn to stop. And first, we need an admission. So the levels of treatment is a person to admit that he has a problem. Then when you come, there's an assessment that is done. We assess you to know whether you are having any medical conditions. Some people may even need a detox. A detox is when you have to admit at the hospital. We have two types of detox. An admission one where we run IV treatments for you. There's people also who come with just need some oral medications. Are you getting the point? So we look at that one, do the detox, and after that, the basic thing they need is a counseling.
The counseling.
Yes, so the truth of the matter is that anybody who get addicted has to go through this medical treatment, which is just 5%. What I told you about detox, or
It's
just
just
5%.
5% of the 100%.
The 95% is about counseling.
Whoa.
The person has to learn how to stop on his or her own. There's no medication in this world that can let somebody stop using
Okay.
marijuana. It's for the
Okay.
person himself. So we say that you have the problem, you are the same person that has the solution.
Okay.
So you have to come. We have two level. We have to, when it comes to that counseling, we have an outpatient counseling. Where I come from, there's an outpatient. You come and
which means that they
you
don't
just
sleep
come,
there.
you don't stay,
Okay.
and we talk to you, and you just go. You get me, but after that, to even prove after the assessment, because some people will have to go to a rehab where you have to stay there. So there are people who go there, stay there for a minimum of 3 months. Some have a maximum of 6 months, you see,
Depending on
your condition. So that is how it is. Once you got into addiction level, you need to see. You need to go to. I'm saying now we have addiction hospitals, like we have addiction clinic. You go to Kolebu, there is one addictive disease unit. Like I was telling you, it's an addiction clinic. You go there. You go to Accra Psychiatry, and we also have those things. And we go to Pantai. So we have private ones too as well.
Okay.
So you just have to do a walk-in, and just let them know that this is my problem, and they will help you. Because some people will decide to help themselves on their own. You may try even your own. This thing will not help you. Once you have gotten into the addiction, like I was saying, you have the withdrawals, everything is showing. Then you need people resort to, you know, herbal medications and all those things. But once you have gotten to the level of addiction, the truth is that you need to go for counseling. That will make you stop.
All right. So what about families, parents that their wards are
Addicted.
to?
So the problem is that the family is the one who suffers most when it comes to addiction. You see, so we always say that addiction is even a family condition because the person that has a problem and the people that are around him are affected. Until the person gets better, all the people around him that want to help have problems. So we have something called codependency. Because you are dependent on the person, so you are also sick. So what we do is that we take the family through a holistic counseling. So when an individual comes to us, we need a family. So we have a family session. We talk to them, explain to them, you know, that what is actually happening to their because they all have their own reasons why the person got there. Some think it is spiritual. Some think it is the person is a bad person. That's how come he's addicted. You see, so we explain to them that no, the person is sick, and it's you people have to help. You see, so we have sections that we do with the family. And that's the only way that we can help the family. Because seriously, the family also become confused, and I don't blame them, because addiction itself is the most weird chronic condition you can ever have on earth. So that it's a systematic something. The family needs counseling, they need to talk to, and they need to help us to also help their clients. Are you getting the point?
All right, so friends, it's been an awesome discussion so far. We're talking about the effect of marijuana. We have said enough, and what Charles is telling us, a parent whose ward or children are addicted to, please, it's time taking. You are not free unless they are free, and once they are addicted, it affects the whole family. And please, let us take time on them. Let us be soft on them. We shouldn't do them high those things, right? Yeah, so that at least they will feel welcome whenever they come home. If we desert them or reject them, we'll make it worse. And we'll make it worse.
Yeah.
So we need to, and also friends, we shouldn't point fingers on them. You see, we always talk bad about them. We also always let them feel that they are this, they are that. Because of that, people wouldn't even come to you to talk to you on that. And as he said, the most important thing is counseling, and counseling comes with listening. Let's listen to them, please. Let's listen to them so that at least we can help them. Senior Charles, your words for us, so far as marijuana addiction is concerned. What do you need to tell parents? What do you need to tell the youth about the usage of weed?
Okay, so what I want to tell the youth, the family, and all those watching us is that, you know, drug doesn't make anything better. When it comes to addictive substances, it doesn't make anything better. Anybody who deceives you as a youth that drugs will boost your morale is a lie. At the long run, you are going to suffer. So for me as a therapist, what I want to tell you is that don't start using any of the psychoactive substances. Don't try to work around with it. Don't try to use it as a form of academic approval. Don't think about that. God has given us the strength and the power to do things. So look at that one, you know, tap from what God has given you, because you will not like it. Now to the family, I want to tell them that if you see that your ward or somebody that is a significant other has a problem, you need to look for the right, you know, solutions. You see, there's always one thing. When somebody is sick, you need to go to the hospital and seek advice. If you have anything that you want to add up, you can add it, but just go to the hospital. I'm telling you that we have addictive clinics now. We have addictive disease unit at Korle Bu Teaching Hospital. We can just do a walk-in, tell us your problem, and we can tell you professionally how you can. Don't go and pass around other places before you come. It may be too late. So that is my advice to everybody, that we should look at these things and work on us. We are human beings, and definitely you have a problem. When you have the problem, what shows that you are human is how you solve it. And we can do it. We can do it.
And addiction is not spiritual, right?
Addiction is not. Addiction is not. It's not somebody that is doing it to somebody. Let you know that one. Because spirituality, people understand spirituality differently.
Okay, so somebody is doing it.
Let me come down to tell them that addiction is not
somebody
that is doing to somebody. It's a disease.
It's a disease.
So even if it's somebody that is doing to somebody, go to the hospital and start the clinic one and pray.
And pray. All right.
For prayer, you cannot leave it, because even in our treatment,
we pray.
We enforce them to pray.
All right. So friends, I'm happy to begin the new season of Wounds of the Heart with this topic. It has been interactive, educative, and I thank you guys so much for staying with this program since day one. And as I said, this time around, we wouldn't do more of the studio. We'll be going out there to offices, to homes, or to their comfort zone to bring you this program. That is why I'm saying that in case you're a church, a school, or an institution that you need us to come, please, the number to call is 0208 491919. 0208 491919, and we will just receive a WhatsApp, a text, or a call we'll do on this line. So please, we will just come, and with my guest and your audience, we will ask for questions as we do, so that at least we will have a beautiful discussions together. Your school may need it, your church may need it, your institution may need it. We will accept those invitations to come your way. And as I said, stigma is not something that we need to talk about, because it is not nice. It is killing most people who are addicted. We should stop stigmatizing people who are addicted to whatever is around. Please, let's accept them as our own. And I know the Lord who made us who we are will definitely help them also to be free from those things they are going through. I spoke with Charles. He is an expert. Charles, your credentials again for my people to know.
I'm a certified addictive professional counselor. Mm-hmm. I'm the head of addictive disease unit, Kolebu Teaching Hospital. Mm-hmm. I'm also a mental health practitioner.
Yes. Charles, your full name?
Charles Kwachi Osei.
So Charles Kwachi Osei is a family man. He's a family man, and you heard his credentials. So please, if I should give his contact, more money in so you there more family, you know. And when you call me and you want to see, I'll ask permission from him and his time of free, so that I can pass on the calls to him, or the contact to him, so that you can deal with him freely. So if you need Charles, the contact I gave out is the same contact that you call, 0208 491919. 0208 491919. And we ask for sponsorship. If you also want to advertise your product, a product that about fashion, about food, about anything. Today I want to leave you with this memory verse, Psalm 27 verse 10. Oh. The Bible says that when my father and my mother forsake me, then the Lord will take care of me. Yeah. When all people will neglect you, the Lord says that He will take care of you. It doesn't matter how long you have done this weed. It doesn't matter how long you have done this. You have been into this addiction. Just accept it, and the Lord will take care of you. I've been your regular host of this Wounds of the Heart, and the name is Pastor Daniel Abedu-Bidiaba. I'm out.
The wait for the Physical Youth Campaign is over, and we have been charged to go. Yes, we will go. Adventist Youth on a Mission. Get involved. The Obuasi Estate Youth Federation is organizing yet its biggest youth campaign after keeping safe of the dreadful COVID